Good evening, Berkeley. I'm your mayor, Jesse Edegane, and thank you for joining us for this virtual town hall on the City of Berkeley's response to the COVID-19 emergency. We're joined today by the City of Berkeley Public Health Officer, Dr. Lisa Hernandez, Acting City Manager David White, and Director of the Department of Health, Housing and Community Services, Dr. Lisa Varhus. And look forward to providing updates on the city's work in addressing this public health emergency. But I first want to just wish everyone a very happy new year and hope you had a safe and pleasant holiday season, and hope that you were able to stay at home. And in the backdrop of this holiday, we've seen an alarming spike in cases, not just in the Bay Area, but throughout the nation and throughout the world. And we are still waiting on data to show whether there was a spike in cases due to New Year's. But this is probably the most difficult time throughout the entirety of this emergency, with the significant surge in cases that we're seeing. And it's essential that we continue to stay at home because it is going to help save lives, especially with the potential of a COVID mutation that we know is now in Southern California and may at some point be in the Bay Area as well. So the best way to protect yourself and our community and to get us through these next few weeks and months to when a vaccine is going to be widely available is to continue to follow the stay-at-home order, to practice physical distancing, to wear a face covering, and to not leave your home except for essential business. This is really critical. I want to thank everyone that did stay home for New Year's, that did not visit your relatives for the holidays, that did follow the stay-at-home order, because it is going to help us manage the surge and to help get our community through this crisis. On a very sad note, I want to acknowledge that we've had 2 more deaths of City of Berkeley residents who've succumbed to COVID-19. These deaths were announced recently, so we're now at 12 deaths due to individuals succumbing to COVID-19. And Dr. Hernandez will talk about our case rates in the city of Berkeley and some of the trends that we're seeing. But once again, we are seeing an alarming increase in cases, and we're seeing this statewide. And so I know that the city of San Francisco recently announced that they're extending their stay-at-home order. We are under the state of California's order, and I'm sure discussions are ensuing about the city of Berkeley and whether we're going to extend the stay-at-home order as well, because we do need to make sure that we can manage the surge that we are seeing. But I just want to take this opportunity to thank our incredible city organization, who has really worked hard over this past year to respond to an unprecedented emergency. And it's been the entire organization, from our firefighters and EMTs to our police officers, to our administrative staff, to our public health staff, obviously, who are working very hard to address this public health crisis. And other city workers that stepped into new roles that they did not necessarily sign up for, and were not necessarily trained to do, but sacrificed and stepped forward to try to help this community, staffing childcare programs, helping with contact tracing, and assisting in other ways for us to respond to this pandemic. And so I want to take this opportunity to thank not just our essential city workers, but the essential frontline medical staff, the grocery workers, the bus drivers, all the people that are making our economy and our community run during this emergency, and who are doing so at great risk, to make sure that we can get to work, to make sure that we have food on the table, to make sure that we can stay safe, to make sure that we can get through this crisis. So as we're now in a new year, there is light at the end of the tunnel. There's hope on the horizon with the vaccine. And we'll touch upon the timeline and the distribution of vaccine in our town hall today. But we need to continue to stay vigilant to get through these next few days and months, because the threat is real, the surge is happening, more people are getting sick, and we have to be even more dedicated to fighting COVID-19 now more than ever. So it's with that I want to now turn the floor over to Dr. Hernandez, our public health officer, and just want to acknowledge it's not common that public health officers have done a twice a month town hall answering questions directly of local residents. And I just want to acknowledge the transparency and accessibility that Dr. Hernandez has provided the Berkeley community and her commitment to providing regular information about our response to COVID. So I want to turn the floor over to Dr. Hernandez. And Dr. Hernandez, if you can give us an update on the number of cases in Berkeley currently, any trends, any additional information you'd like to share. And I know that we'll also talk about the issue of the vaccine distribution as well.
Yes, good evening and Happy New Year, Mr. Mayor and City of Berkeley residents. I wanted to just make a statement before I go into the data, just a little different than normal. I start this year with mixed emotion, one of both hope and sadness, partially because of what you mentioned, Mr. Mayor, in terms of our cases. Our cases are at an all-time high, and we expect to see more of the surge in our number reflected in our numbers in the next coming days because of the surge due to the holidays. I mentioned this before, a surge on top of a surge. We're going to see that. So that's my sadness component of my message and how I feel. And there's a mix of hope, though, because we see vaccines on the horizons. So with the vaccine on the horizon, we know that more and more people will be protected against this virus, and we'll be getting closer to controlling the virus. That said, we're still in a time where most people are not vaccinated. And even when we do get vaccinated, we still have to practice the public health measures that we know will keep us protected with making sure we are wearing our face coverings, our mask, covering our mouths and noses when if we sneeze or cough, washing our hands, and staying home when we're sick and physically distanced. So that said, I will go on with the numbers and talk a little bit about Alameda County cases, and then our case rates, both for county and city. First, Alameda County, we're now at 51,774 confirmed cases with 647 deaths. That's not including City of Berkeley numbers. Hospitalizations are at 429 currently hospitalized, with 116 individuals in the ICU. Again, these are highest numbers that we've seen throughout the pandemic. Those two numbers, the hospitalizations and ICU, do include City of Berkeley numbers for our residents. In terms of the case rate, this is the rate that the state calculates weekly. Last was on December 29th. For Alameda County, the case rate was at 44.9, so 45 cases per 100,000 per day, and that is an unadjusted rate, and our test positivity for the county is at 7.3%. So these numbers are higher than the reports that I gave last time we had our town hall. For City of Berkeley, our numbers we're reporting from December 30th, we're experiencing throughout the state some
these numbers are higher
with
last time
already the reporting database. I think
December 30th.
People could put their
throughout the state.
Sorry, one second.
Zoom on mute.
Alicia,
the reporting.
there are a number of people that signed on that are not supposed to. So if everyone could be on mute, and Dr. Hernandez, please proceed.
Okay, great. So our numbers, our case rates are from the 30th because we were having some difficulties with the reporting system, CalReady, which is the state reporting system. We're now at 1,940 confirmed cases in the city of Berkeley. And we are averaging about 14 cases per day at this point, but we are going to see that case rate cases increase because of the surge that we are seeing in our cases. Deaths, as Mr. Mayor reported, we are now at 12 deaths for City of Berkeley residents. That's an increase of 3. These were in individuals that were over the age of 60. In terms of tests reported to us, we have 156,991 total tests reported to City of Berkeley Public Health. We're averaging about 640 tests per day, and our percent positive is at 1.3%. When we look at our case rate, we calculate our case rate on our own. Our case rate now from the 29th was at 17.6 cases per 100,000 per day, and our test positivity is at 1.6%. Another indicator that we're looking at as a state, and as I reported last, the state has broken the counties into regions, is ICU bed capacity. And we look at it in regions as well as for overall capacity for the state. The ICU capacity for the state is now at 0%. And our Bay Area, which includes Alameda, Contra Costa, Marin, Monterey, Napa, San Francisco, San Mateo, Santa Clara, Santa Cruz, Solano, and Sonoma, our ICU capacity is at 7.9%. And the regions that are at greatest impact are Southern California and San Joaquin Valley at 0% for their ICU. So this is an indicator of our sickest individuals who with COVID, and it shows that we are truly seeing an increase in the cases, an increase in individuals who are getting the most severe cases of COVID. Here in the city, we are continuing to handle multiple worksite exposures and cases, as well as multiple outbreaks. I reported on Golden Gate Fields last town hall. We are still working with Golden Gate Fields in managing that outbreak, as well as other outbreaks in other work sites and skilled nursing facilities. That is basically our day-to-day work. The new COVID strain that we are aware of now hasn't been detected yet in Northern California. It has been detected in Southern California. It does not mean that it's not here. I do believe that it's circulating in the region, even though it may not have been detected yet. What we know about this strain is that it seems to be more contagious. It's just not more lethal. It does not cause increased complications from COVID. So it behaves the same way in terms of how it impacts individuals' health. It's just more easily spread. We are continuing to learn more about that strain, but as it stands now, that's what we know. And what we also know is that the vaccine seems to cover this and is protective against this new strain. So I just wanted to mention those two things about the new strain, though we will report on any other new information that we have on that strain. So at this point, what we're recommending continues to be the same, which is staying home when you're sick, wearing face coverings when you're outside your home, maintaining your physical distancing, and washing your hands regularly. With that, I'm going to hand it over to Dr. Varhus, who is going to provide an update on vaccines.
Thank you so much.
Mm-hmm.
There we go. Okay. Good evening, everybody. Happy New Year. Despite the current grim challenges that we are facing, and it is a challenge, we will get through this period together. We are strong. And we are very happy to be able to share that we have a big new tool in our toolkit, which is the vaccine that has come to Berkeley. And I'll start by saying that the vaccine distribution is really being driven and led by the Center for Disease Control in California. That's in partnership with the California Department of Public Health. They are really working hard 24/7 to provide guidance and direction to local health jurisdictions and other entities. And often due to circumstances, whether it be disease in the community, evolving circumstances, capacity of the health care healthcare system, they are providing strong guidance and then from time to time making changes. So I just want to start by saying this is very much a work in progress that shifts literally by the day. But I do feel very confident there that not only does Berkeley have very strong and competent staff that are working on this, but the guidance that we are receiving is some of the best guidance. And we will continue to grow and change and be strong as we begin this unprecedented rollout of mass vaccinations. So I'll start by sharing that Berkeley has begun to receive its first allocations of the vaccine. The first box of vaccine arrived directly to Alta Bates Medical Center. That was 975 doses of vaccine that is directed toward their frontline healthcare staff, which they actively began to vaccinate their staff. I believe it was prior to the Christmas holidays. The second dose that the city of Berkeley received, we received 700 boxes of vaccine from Moderna, and a week later, an additional 300 boxes, and then today, an additional 100. So we have now received 1,100 doses of the vaccine, of the Moderna vaccine, that is being exclusively allocated and delivered to frontline healthcare workers in the city of Berkeley as prescribed by the phase 1A of the recommended or the required allocation of vaccine. And so just to share sort of what are some of the first phase really is expected to be specifically to people that are working in the health field. As Dr. Hernandez said, we are under an unprecedented strain on our hospital system. And the first thing that we absolutely have to do is protect our diminishing workforce that is already stretched and protect our systems to be able to provide the best quality care possible so that we can get through this together. The other thing that we have to be able to prepare for is to broaden our efforts around vaccinations. So this may involve, for example, our healthcare systems delivering vaccine, our medical clinics delivering vaccine. So we really have to strengthen the system so that we can really take care of our population through this critical time. So phase 1A is basically broken up into 3 tiers based on the most need and the most urgency. So tier 1 includes, for example, acute care facility, acute care hospitals, paramedics, EMTs, people that will actually come in direct contact with and transport COVID patients, dialysis centers, staff of residential and inpatient substance abuse disorders and treatment. And actually, I'm going to back up a little bit because I'm going straight into what Berkeley is doing, but I forgot to mention, and it's extremely important, that there are actually 2 areas. One is the healthcare workers, and the other one is residents and employees that work within skilled nursing facilities. That is the priority of phase 1A. The reason I jumped into what the city of Berkeley is doing is because our skilled nursing facilities and long-term care facilities, they are signed up to receive vaccine through what is called the CDC Pharmacy Partnership, where our SNFs and long-term care facilities have signed up and have been confirmed a particular pharmacy that will be delivering their vaccines on site. And we did get word confirmation today from the state that 3 of our facilities are either have already begun to receive vaccine or are in line to get that vaccine within the next week. The state is letting us know basically just within a few days before that those vaccinations at these facilities happen. We get the information with a very short turnaround time. So there may be additional facilities that are already very close to being scheduled as well. So we were very hopeful that that pharmacy partnership is working so that people can get the on-site vaccinations to both the residents and the staff who are the ones who are coming in and out of the facilities frequently. And so that will certainly help to protect some of our older residents. So that partnership is leading the vaccination process with their dose of vaccine, which we don't actually know exactly how much vaccine they have, but what we do know is that as each pharmacy goes into the facility, they have enough vaccine to vaccinate the entire facility. So we can be very optimistic that that partnership will work well. And hopefully by the next update, we will have, even by the next town hall, we will have more information. What is the city of Berkeley doing? We are following the phase 1A guidelines to make sure that we are vaccinating all of our healthcare workers in accordance with the 3 tiers. The first, which I already named, was acute care, people that really are directly in contact on a daily basis. The second tier includes community health workers, public health field staff, staff in intermediate care facilities. And then the third tier really focuses on specialty clinics, laboratory workers, dental, and other oral health clinics. And so very, as you can hear, very specific to healthcare services industry. To date, as of Friday, we had provided nearly 500, and I'm sorry I didn't get the exact number, but it's about 496 vaccines to frontline healthcare staff. We will be continuing in this week with a second closed vaccination clinic that will run over 3 days. And we are rapidly using up all of the vaccine that we were receiving, and we are committed to not wasting a drop. In fact, in a few instances, we were actually able to squeeze a little bit of extra out of those vials, as you may have heard on the news. And so we are actually, our staff is doing an amazing job. We are continuing to work through 1A. Like, we cannot give a sort of deadline for when we will be ready to move on to phase 1B. But at this point in the time, the state is not even allowing us to do that because they want the entire state to get through the 1A process. Our hope is that it will happen sometime in the coming weeks. And that will obviously depend on the amount of vaccine. What I just shared with you, we had 1,100, the Alta Bates has had their 975 doses, and then the pharmacy partnership has their doses. That's still not sufficient for our more than our entire healthcare population, but we are optimistic that that will change in coming weeks. I'll add quickly that after there are questions regarding to age and eligibility. When we complete phase 1A, we will go into phase 1B, which is a much broader group. The state and CDC have still not completely confirmed and finalized this, but what we understand at present is that tier 1 of phase 1B will include folks age 75 and older. They're looking at education and childcare industries, food and agriculture, and emergency services. Be aware that that is still subject to change, but it seems to be being more closely confirmed at this time. We don't know yet how they're going to distribute the vaccine to those populations, whether it's going to be the healthcare facilities, specifically the Kaisers or the Alta Bates that will support with, for example, the age 75 and over population, or they will be asking us to take a lead on that. We're still waiting to hear. And as I said earlier, this is an extremely rapidly evolving, though rapidly evolving, though well-informed process, and will be updating things as we know them. And then it broadens out to phase 1C and beyond as the population and risk levels get less, decreasingly urgent, but still we need to vaccinate the larger populations. I did note on the CDC website today that they are sort of grossly sort of guessing that we'll get beyond phase 1 sometime in the spring. I think that is the that's the basic update for the vaccine. And then I know, Mr. Mayor, there are some specific questions as well.
Thank you. I do think the overview provided helps address some of the specific questions, namely people that are over 75 and who are vulnerable to complications related to COVID-19, but we can get to some of those questions later. So thank you so much for the update. And we're now having to evolve into an entirely different role, which is vaccine distribution. And just want to express my appreciation to the staff in the health department for all your work in making sure that our staff and other essential workers and medical staff are getting vaccinated. Thank you. So Dr. Hernandez, anything else you'd like to add before we go to the city manager's office? Okay, thank you. So now I want to turn the floor over to our acting city manager, David White, who's filling in for our city manager, D. Williams Ridley. And Mr. White, thank you for joining us. And if you can provide an update on city operations and any information you'd like to share with the Berkeley community this evening.
Well, thank you very much. And I really want to express my deepest gratitude to you, Mr. Mayor, for hosting and facilitating this town hall. It's really been important to us throughout the entirety of the pandemic to make sure that we get, as much information out there in a timely fashion. And obviously with the updates that we received from Dr. Hernandez and Dr. Varhus around the vaccine, this was a wonderful opportunity to provide the most timely information that we can. So one of the things that I obviously want to reinforce, you've heard it multiple times, is, we are in a difficult period of the pandemic. And it goes without saying that we want to continue to strengthen and reinforce the messages about all the precautions that we've been taking day in and day out, particularly around wearing masks and washing our hands and physical distancing. But one of the things that I do want to talk about is really build on the message from Dr. Varhus around the enormity and scale and complexity of getting this vaccine out. And so with that will come a strong pivot organizationally so that we can really help to support not only each other within the organization, but to support the community. And we are very attuned and aware of the fact that there are a lot more questions that we have answers to at this point in time. And so one of the things that we're going to be committed to doing is making sure that we can get the best possible information out there. One of the things that we will be doing is mobilizing resources within the organization to support the vaccine distribution effort, because we want this to go as smooth as possible, understanding that this is an enormous undertaking and something that, hasn't really been done on this wide of a scale in a very long time. So we appreciate everyone's patience as we, rededicate and redistribute our resources to be effective and efficient. That may mean that there will be service disruptions in some other regards of the organization, and we'll do our best to, obviously transmit that and be transparent about that. But that is something that we obviously ask everyone to be very patient and understanding as we move forward. Another issue that has come up and we've been very attuned to is around, and I know we'll get into this a little bit, is around enforcement. We continue to have a very strong disposition around education first, and doing our best to provide the resources to the community, particularly around providing masks, providing information, so that folks, really understand and are aware of what the expectations are as we go forward. So, that really concludes the update I have for you, Mayor, and the community right now, and we'll be available to answer the questions that have come in. Thank you.
Thank you so much, Mr. White. So let's now turn to the questions that we received. We received many questions from Berkeley residents over the past week, touching on some of the areas that we've already covered, but we want to get to your direct questions. And I want to first direct the first sort of area of questions to the city manager's office. This first question was around accessing Berkeley Unified School District school grounds for exercise and social distancing. And this resident asked, when will the city get access to school grounds subject to the new MOU so we can all be outside exercising and social distancing? We need access to more green space. I want to acknowledge that we did adopt the new MOU with the Berkeley Unified School District on December 15th. That took effect that very day. The Board of Education adopted it, I think, a week prior. So want to turn it over to you, Mr. White, if there's anything you'd like to add about, I think that MOU is now effective now that we're in a new calendar year. But I want to turn over to you if anything else you'd like to add about sort of accessing the additional school sites that we're now able to under the new MOU with BSD.
Yes, the MOU was adopted, and I want to thank, obviously, you, Mr. Mayor, and our council for adopting that MOU, as well as the school district for their tremendous partnership in moving that document forward. It took great effort and wonderful partnership to get there. You know, as it pertains to the open space and the parks, you know, there is some additional resources that we have available to us, but in totality, not a lot of change in terms of what's available to the community. And in our conversations with the school district, with the schools being closed right now, it is our understanding that it's their intent to also have the open space at this moment in time closed as well. We continue to have conversations with them about that, but right now that is the disposition that we're working with. And as schools are opened up, we do obviously hope to have access to that open space as well.
Thank you very much. There are a few questions around enforcement, and you touched upon this in your initial comments. One question, why is there no actual enforcement of the mask mandate? I constantly see people walking around outside, definitely within 30 feet of me and often within 6 feet of me, without a mask covering their face. The city gives tickets for noise disturbances, etc. None of these is as dangerous as COVID-19. So I guess the question is, are we enforcing the face covering requirement? I know that we adopted legislation in early September to give the city the ability to impose fines for not complying with the face covering requirements, although we're focusing, I think, on larger gatherings specifically. But want to turn over to Mr. White, anything you'd like to add about how we're dealing with the face covering requirement and enforcement of that particular requirement.
Thank you, Mayor. There are a couple of items that I would just want to amplify with is a couple of things. One is, you know, our enforcement is complaint driven. So certainly to the extent that anyone in the community is seeing areas where there are issues around gatherings or areas where folks are not complying with health officer orders, we ask folks to let us know that so that we can bring resources to bear. As I mentioned before, our approach is obviously around looking to do education first and providing resources so people have the tools to comply with the health officer orders. But we do also have folks not only in code enforcement, but in our environmental health division that are very active in responding to complaints that come in around non-compliance with health officer orders and do go into the field on a regular basis, particularly to help folks comply. In situations where we've had recurring offenders, we have had to look to the ordinance the council adopted and use that as a tool. So again, we ask folks to please, if you know of areas where people are not complying, to let us know. If it's during the day, you can call 311. You can also send us a note to our covid19@cityofberkeley.info email address. And then if it's not during the day, you can obviously use the non-emergency 911 line as well to provide us the information so we can help provide that enforcement support.
Thank you very much. There was a question around the dashboard, and it might be better suited for the health department. This resident asked, sort of, why don't we update on the weekends? And for certain browsers, it's kind of slow to load. I know that on my Mac, it's a little slow to load as well. So I don't know if Dr. Hernandez, you want to address that?
Sure, I can address the first part, the browser internet thing. I think there's a note on the dashboard that says if you're having problems loading it, use Chrome or some other platform. I'm not 100% sure about which one to use, so I would defer to the website for that part, because I know that is definitely dependent on the browser that you use. In terms of updating on the weekend, we switched to just doing updates during the week because this has been a 10-month plus response. And we, at this point, determined that we wanted to give the epidemiologists a little bit of a break in terms of putting that data on the web. We're hoping that we can have it automated so that there isn't a change in the updating schedule. But at this point, the platform that we have does not allow us to do that. And we're not alone. About 3/4 of the jurisdictions are not updating on the weekend anymore. So it was something that we thought about when we thought about changing. We were looking to see what the standard was across the state.
Thank you. I just want to also note that if you can't see the dashboard, sometimes you need to turn off blocking third-party cookies in your browser settings, or you can load it in a separate window and it should be able to pop up. So there are certain browsers which it does better on, and also be sure that you're not blocked from being able to actually open some of the windows to see the actual data. Thank you so much. I certainly find the dashboard extremely helpful, particularly being able to track the progression of cases and some of the demographics of those that have been infected. And I think it's very helpful information for us to have. Moving on to the next sort of set of questions, which are sort of health related, I will now direct them to Dr. Hernandez and Ms. Varhus. There was a question around how up-to-date and accurate is the data on COVID-19 cases by zip code? I don't think we're yet reporting data in the city of Berkeley by zip code, and I'm not sure if the county's still doing that. I know that they were doing that.
So the county does do that. We do not. And the county took a break as well from reporting data. I think today it was from sometime a little before Christmas, I believe, until today. So those numbers should be updated. That said, I did reach out to the county to ask when they update, but that's their process. So I'm not really sure how often they update during regular times as well, if it's daily or if it's something of a different cadence.
Okay, thank you so very much. We talked about the updating of the data, demographics of local cases, particularly deaths. I know that it's something we touched on before. I'm sure it's really a time capacity issue, being able to do that sort of granular of analysis. But we do have some generalized information on the dashboard about being by age and by racial demographics of people that have contracted COVID-19. I know the county also has some specific demographic information that they provide as well. And then they provided the information by zip code. In terms of deaths, I'm not sure that we can disclose that information right under federal law.
Correct. We're presenting as much data as we can at this point. We're hoping to, and I know I've said this before, but we're hoping to provide more data, and there'll be more data on our web in terms of not necessarily deaths, but when it comes to some of the other exposures, partially because it's required by the state to have us start presenting that soon. And with that, the state has provided a bit more resources in terms of being able to provide that, because the data systems that we use normally didn't have that capacity. So that's coming soon. It's not there yet, but we will see new data being presented. But what we present as much as we can, as quickly as we can. But again, it's based on what we're allowed to by guidelines, federal guidelines, as well as capacity.
Thank you so much. There's a question about the sort of the safety of the farmers market's current operation. And I know that, we consulted with them early on in the pandemic around when we were discussing with them whether they can operate, around how how to distance their tents and how many people can enter, and having people physically distance. At the present time, the farmers market is still allowed, correct? And if you want to touch Dr. Hernandez or Dr. Vargas around the, as long as they're complying with those requirements, it should be safe for people to go.
Yes, as they're allowed to operate, and my feeling about any exposure outside the household, whether it's your grocery, you just need to limit your exposures outside of your household, because we know that every exposure increases your risk.
Yeah, and I think that touches on the next question, which is grocery shopping risky? Leaving your house is risky if you come into close contact with other people, particularly with the increasing number of people that are contracting COVID-19, which is why I think it's really important for people to not leave the house unless you have to, unless it's essential business. And there are certain requirements that grocery stores have to operate under in terms of how many people are allowed, and physical distancing and other safety requirements that they have to abide by. And so it isn't completely safe, but I think it's really a question of how it's done in a way to make it safer, and how we're managing the risk, and how we individually are managing the risk. But Dr. Hernandez, anything else you want to add on that?
No, I was just going to add also, there's a tool that I never really paid attention to until the pandemic on the web, where it shows you when a certain store or is at its busiest. So that's something I would say as well, is to look to see if you can go during those times when it's less likely to encounter crowds. So that's the other thing. But again, it's just about trying to be safer when you're out doing your essential tasks.
And I know that a lot of stores have special hours for people who are usually over the age of 65, so as to ensure that there isn't a large clustering of people inside the store and there's adequate physical distancing. So thank you to the resident who submitted that question. There was a question around beauty salons and barber shops. And is there data on cases tied to those businesses? This resident noted that LA and San Diego have released statistics related to cases tied to those particular types of businesses. And has Alameda County provided specific data related to COVID cases that occurred as a result of those business operations? I'm not aware, but I don't know if there's any additional information you might have, Dr. Hernandez.
Yeah, I'm not aware of Alameda County presenting that data at this point. As mentioned, there will be more information about exposure settings for outbreaks that are going to be presented. And that's going to be something that all local health jurisdictions will have to present. But that's I think different than what LA and San Diego are presenting. And I can't speak more for what Alameda County might have scheduled for presenting at this point. I haven't heard of them providing that level as LA and San Diego are doing.
I know that, just speaking generally without speaking to specific individuals or specific information about those specific cases, that a lot of the cases have been around essential workers, correct? And what are some of the other kinds of generalized activities that have been kind of the major causes of cases that we've seen in Berkeley?
They fall into two buckets. One is social gatherings. So gathering, it doesn't have to be large, but gathering with people outside of your household, and then worksite exposures as well. And those sometimes seem to happen in settings where people are more relaxed. So break rooms or on break. So it's at work, but usually in those settings where people are able to congregate or are not doing their task, they're on lunch. So that's what we're seeing, continue to see at this point.
Thank you so much. There were a number of questions on school reopening. We had a special town hall with Dr. Stevens last month. He provided some specific information about BUSD's work and I also provided some information on the city of Berkeley's work to help the district reopen. There was a question around why we haven't allowed waivers to reopen elementary schools. We did allow, up until the recent stay-at-home order took effect, elementary schools to open. Berkeley Unified School District wasn't ready to do that. That wasn't a city of Berkeley decision. That was a BUSD decision. So I just want to clarify that. We had created the legal process for them to be able to seek a waiver and to reopen under specific protocols, but they're still working, within their district with their staff to develop their plan for reopening when we're able to reopen, when the stay-at-home order is lifted and allows it or is modified. So I just want to clarify that point. It isn't a city of Berkeley decision. It was a BUSD decision in terms of the timing. But presently, under the stay-at-home order, if I'm not mistaken, Dr. Hernandez or Dr. Varus, we are not allowing schools to reopen. But I know it's your commitment, Dr. Hernandez, I think it's all of our commitment, that the schools are the first priority when we're allowed to reopen, that we want to prioritize that probably more than other types of activities, because we know how difficult it's been for parents and for our students to not be able to interact with other students and to have in-person learning, and the learning loss that we experience, and the opportunity gap that creates in our community, the further widening gap that creates in our community.
Absolutely. And I will say that beyond the waivers, schools were able to open, and we did that incrementally without waivers when we were in disease status where we had lower case rates and test positivity. So that's the other thing. We were allowing schools to open beyond the waiver process at a certain point. Now, of course, we're back again with not allowing additional schools to open, but we're hopeful, as you say, with once we're able to get to that point as determined by the state, we're going to prioritize schools.
And Dr. Vargas, I know that we allowed some sort of smaller cohorts of kids to and teachers to kind of meet for some sort of limited in-person instruction. We kind of had a sort of small scale program that the district launched, that we allowed up until the stay-at-home order took effect. And I guess to the extent that the health orders allow it, that could happen at other school sites in the city of Berkeley.
That is true. And in fact, when the new stay-at-home order was issued by the state, and I also want to be clear, it was issued by the health officers in the Bay Area responded quickly, but we were quickly under the state order anyways. That we did want to encourage schools. Schools were allowed to remain open, and the small cohort programs were allowed to continue. Also just want to add that Dr. Hernandez is right, that it's a top priority for us that our kids are able to be connected, learn, be in person. And we're just partnering with the school district. I know, Mr. Mayor, you did a town hall recently. We're committed partners. And it's their jurisdiction, and we will do what we can to be supportive and encourage.
Thank you. Yeah, I mean, we're all committed to doing what we can to, and there's been a lot that the city has done over the past year to support BUSD with technical assistance, with working with them to design programs, to develop safety protocols. I know that the health officer meets, and you also meet, Dr. Varus, with district staff on a regular basis to help work with them to develop their plans. I think at the present time, the stay-at-home order is the kind of the obstacle for reopening at the present time, but the district is actively engaged in discussions with their employees, because they need to engage their employees in a process to talk about what that plan is. And to develop the testing requirements and safety protocols, and to determine how many and which teachers are going to be allowed to work. And that's just for the elementary schools. It doesn't include the high schools, which is a much more complex issue, which we're going to have to address at some point in the future. So on to the next question about school reopening. Is it possible to open outdoor classes at Sylvia Mendez for smaller children? There's no outdoor transmission and they deserve to be in person. I know that we've been talking to the district about outdoor instruction. And I know admittedly the weather's changed now from what it was in the summer and the early fall. But I know that we've had some conversation with them around that. And I guess I guess at the present time, the orders have to allow elementary school instruction to happen. But once they do, that does, I mean, Dr. Hernandez or Dr. Vargas, that's something the district could implement if they wanted to.
Yes, they can. I wasn't sure if Dr. Vargas was, who can go first with the mute button? Yes, they can. At this point, they can as cohorts.
Yeah.
And then when we're able to have additional opportunities for learning, then it would be up to the schools based on whatever the restrictions are from the state to operate.
Yeah, I mean, just again, to reiterate, we're not allowing the schools to operate their cohorts. They're having to work their way through their process to be able to do them with and keeping their staff, families, and community safe. And it's a very challenging process. We're right there as a partner in the back, but ultimately these decisions really lie with them. And we can be supportive and respectful of their intentions and wanting to make this work for everybody and needing to make it work for everybody. It's a very challenging process.
Yeah, I'll just note that, the district is a separate independent government agency with its own authority under state law. And, while we work very closely with the district and support their efforts, we, as the mayor, city council, or city administrative staff, we don't have any authority over the district's the decision-making about when and how they're going to reopen. But we are providing a lot of support and technical assistance. And I made it very clear and will continue to make it clear that I believe it must be our top priority to reopen our schools as soon as we can. And I'm committed to working with the Board of Education and with the district staff and our staff to help support that in any way we can. And I know the governor recently announced a California Safe Schools for All plan, which the state's going to provide $2 billion in funding beginning in February to help support TK to second grade kids returning to school. And that will support, I think, a variety of ways, such as testing, PPE, contact tracing, vaccinations. All these things are really essential. I know in my conversations with Superintendent Stevens, they need testing, and the state didn't provide any money for them to do the testing. And so this funding from the state of California is extremely helpful for us to be able to get our schools reopened as quickly as possible. So thank you. I think we covered all the school reopening questions. There were a couple of questions on skilled nursing facilities. First, what is the status of COVID infections at Berkeley nursing homes and assisted living facilities, and what's the plan to get residents and staff vaccinated? I know that you touched upon this, Dr. Vargas, in your sort of initial comments, that we've been working, with the state to help make available the vaccine at some of our skilled nursing sites. But if there's anything else you and Dr. Hernandez would also like to add on that issue as well.
I'll start with the disease containment part, with the disease control part. We continue to work with the skilled nursing facilities when they have cases in their residents and staff, and work with them specifically on disease control and managing the outbreaks that they might have. I won't give specifics about different facilities, but we work with all of them. And sometimes that requires additional measures, like they're required to do testing of their staff, but when regularly, but when there is a case, which they consider, the state considers an outbreak whenever there's a case, then they have to do additional testing, and they have to do testing of both staff and residents. In some facilities, we are asking them to increase their testing to more than just weekly to twice weekly because of the number of cases they are experiencing in their facilities. So we do tailor our support and the recommendations and requirements that facilities have to adhere to based on the level of disease in their facility. So that's one thing. And in terms of vaccination, as Dr. Barhu said, vaccine is being provided to skilled nursing facilities and residential care facilities as well through a partnership from CDC. And that's through CDC and Walgreens and CVS pharmacies. And they are starting to vaccinate throughout the state and starting to vaccinate this week in the city of Berkeley skilled nursing facilities. Because we know that these are this population is the population that needs the vaccine the most. And that's why the CDC, at the federal level, there was that commitment and that approach first. So that's what's happening. And we're working with them to make sure that they're getting vaccinated and also getting the support that we provide regularly, whether it's when there's an outbreak or not.
I will add to that there's a question about what we are doing to help facilitate them moving forward with the CDC pharmacy partnership. Basically, as our facilities entered into that agreement, they entered into a different pipeline in terms of receiving vaccine. So our role is really to advocate and to make sure we have the information get the information from the state to make sure we know like what's happening and when they're getting it, and to really advocate for getting that information. But really it's that, and then to be concerned if for some reason it has a problem getting off the ground, and maybe having to rethink how we're going to make sure they get the vaccine, because they are absolutely the priority population. But looks like as of today, they are rolling it out beginning this week. I misspoke earlier. We had information that said that they had started on the 1st, but it was actually the 8th. So in this current week, we'll be starting. So we're very happy about that.
I think that's good news, particularly to protect some most vulnerable residents who live in these skilled nursing facilities. And thank you for all your work. There were a lot of questions about vaccines, and I hope some of the information provided early on is helpful. I'll try to kind of group them because there's a lot of similarity in some of the questions. We talked about skilled nursing facilities. We are beginning to vaccinate under 1A our EMS personnel, right, and fire personnel.
Yes.
And I believe 1B, we will, at the present time, does anticipate that we would vaccinate other first responders, correct? Or has that changed?
No, currently police are as part of 1B, and the EMS paramedics are part of 1A. That is just a simple way in which the CDC has prioritized allocation.
And so we're getting through making sure that we vaccinate all of our fire and EMS personnel. I know that I got a picture texted to me, I think last week, of one of our first EMS personnel who've gotten vaccinated in Berkeley. And so we're working through to make sure those staff are vaccinated, because we know that they're usually the first people that you interact with if you call 911. So you want to make sure that they're safe and that our residents are safe as well. So we're prioritizing that, just like the state and the federal government's prioritizing the frontline medical staff as well. There's a couple of questions actually about healthcare professionals who are independent providers. When it's anticipated they will be able to get vaccinated, and I don't know where they fall in. I think they would be in 1, but I don't know where they fall in, and whether they're in 1B or 1C.
So healthcare providers are in 1A tier 1. So
Okay.
Yep. So they should be, and I'm guessing you're talking about the pediatricians and the
Yeah.
family doctors. Yeah, those individuals are part of phase 1A, tier 1.
Um,
And we are actively reaching out to them, have been very actively reaching out. However, if for some reason there is a health provider out there who has not heard from us, you can email us at COVID-19@cityofberkeley.info, and we'll help to prioritize and make sure that that it is that you are given that opportunity if you fall into one of those 3 tiers.
so yes, please contact the health department if you are within that tier, so we can make sure we can connect with you and make sure you are able to get vaccinated. I know there was a question around we have begun vaccinating persons under Group 1A, we are, if I'm not mistaken, Dr. Vargas and Dr. Hernandez, we're largely following the CDC and state guidance, but working in coordination with other local health officers. Although we do have the ability, based on our local needs and conditions, to make some adjustments to where people are in the tiers, if I'm not mistaken. But we are following largely the state guidance, the state plan for how the vaccine distribution is being rolled out, mainly because we have to in order to access the vaccine.
Absolutely. We are very closely following it. And that means there's even a question around city employees versus actual healthcare workers. We do have this in this department, health, housing, and community services. We do have a few frontline medical staff that fall into 1A, B, and C, and they are obviously eligible under this, but it is mostly going to providers in the community who again fit tier 1, 2, and 3. We're very, very strict around adherence to that plan and that strategy. Some very great minds went into creating that strategy, and while I'm sure people have unique circumstances and different, can make a case that is different. We're really following some of the best experts in the country and frankly, the world on this. And so we're just aligning very closely with the criteria.
I want to sort of move on to people over the age of 75, because I know there have been a number of questions that we received from older residents of Berkeley around when they're going to be prioritized. I know that the governor just today in his press conference kind of announced, I think, some modifications to the tiered status in 1B. I think I saw that, where older adults are going to be included and government employees as well. So I think at the present time, could you talk about where are people over 75 in the timeline for accessing a vaccine?
So I'll just start by a shout out to my mother, who is a Berkeley resident over the age of 75, who texts me almost daily, asks me if she's going to get her freedom back. So we're still figuring out exactly who's going to be providing that vaccination and what's the best pathway to get there. We hope to know, we probably will know very soon, have some guidance around who's going to be responsible for what. So, and I don't know if Dr. Hernandez, you have any other updates other than that?
As soon as we know, we'll get it going. We're pretty much, as Dr. Vargas mentioned earlier, that as soon as the information comes out, and it comes out often, we are there to respond and make sure that we're ready to provide the vaccine in an appropriate way, whether it's through our own efforts or partnering with facilities or other entities.
So it will likely be that they could access it through us or through their own healthcare providers?
Yeah, yes, it'll be either or both. At this point, we're still waiting for guidance from the state.
So we're waiting for guidance from the state, just so everyone knows, and specifically when once we know when the vaccines are going to be available, I think we submit orders to the state, and then we get the healthcare providers or the city gets those vaccines directly, and then we will get information out to the Berkeley community about when and how you can access those vaccines. So
Exactly.
And I would say that's also part of the challenge now, is that we put in our orders and then we have to wait to see how much we are allocated. So that also changes based on the availability of the vaccine.
So I have a question for Mr. White. I think over the next few months, sort of information, sort of public information to the Berkeley community about the plan and about sort of how people can access the vaccine, I think is going to be really critical. I know that as a city, are we preparing for kind of broad communication to the Berkeley community about our vaccine sort of distribution plan?
Yes, we are. So we are right now looking to, I'm sure many of the folks on this town hall have been to our website, and we've devoted a lot of resources to really building that out to make it a robust communications platform. And so right now we are evaluating how we can leverage that to keep timely information on the vaccine there. And we will also provide, appropriate communications out to the community as we've been doing throughout the pandemic. So we'll be looking to communicate in a number of different channels and platforms, and we're having those conversations and developing those plans right now.
So I know that there are a lot of residents who are over the age of 75 or who are at great risk if they contract COVID-19. I have family members who are in that category who could face significant complications if they contracted COVID-19. Your safety is our deepest concern. Our request and recommendation to you at this time, as we are waiting for guidance from the state and accessing those vaccines, is to please continue to stay at home. I know it's difficult, but it's really essential to protect your health. As soon as we have information, we will begin to disseminate it to the Berkeley community. And I think we do have to rely on the state's guidance and the state's timeline, because they are the ones who are allocating the vaccines to the city of Berkeley, and are helping determine the priorities in terms of who gets prioritized. So it's stay tuned for more information. We are in tier 1 of 1A. We are focusing on skilled nursing facilities and frontline medical staff and medical essential workers in the city of Berkeley are nurses and EMTs, and we'll begin to move to the next phases when the state allows us and when we can access those vaccines. So let me see if there are any additional questions we did not address. I guess one last question: how many vaccine doses have we received to date? That's an interesting question. And do we know how many people have already been vaccinated?
So we know that, as I mentioned earlier, Altabates received 975 doses of Pfizer. We have now received 1,100 doses of Moderna. We assume that the pharmacy, we do not know the exact amount, but we know that the pharmacy that are doing the pharmacy partnership with the skilled nursing facilities and long-term care facilities will be receiving directly. And they're starting, I think, this week. So they'll be receiving vaccine, although I don't have the precise number. We also anticipate that UC Berkeley will also be receiving their own vaccine at some point soon, although that is still a work in progress.
Excellent. Thank you so very much. And so I guess I'll summarize if anything you want to add, Dr. Vargas or Dr. Hernandez, on the vaccine issue, because I know this is the hot topic in the community right now. And, we are all of us are desperate to get vaccinated. That's a good thing, because we know there are some parts of the country where they're not really eager to get vaccinated. And we want to encourage every single resident of our community who can get vaccinated, because it is essential to create a herd immunity and to help us get through this. As soon as we can roll it out, we are rolling out. It's a huge effort to coordinate. And I guess at the present time, if you are eligible in the first tier of 1A, please contact the city, or you have already been contacted through your healthcare provider, through your employer. But we will be providing information to the Berkeley community as we get additional information and guidance from the state, and as we're able to roll out additional phases. But I think the most essential thing is we're not out of the woods yet. Yes, there's a vaccine out there, but not everyone's been vaccinated. And I unfortunately have heard, in the United States, because there's the hope of a vaccine, that some people are letting their guard down and are not sort of following, very, very seriously the social distancing and other public health requirements. And we can't let our guard down. We have to continue to pull through this, to be strong, to get through these next few weeks and months, because there's light at the end of the tunnel, but we're not out of the tunnel yet. So that's my message to the Berkeley community. And I don't know if there's anything else the doctors would like to add on that as well.
I will just say that as I mentioned in my opening remarks, is that there is that beacon of hope with vaccine. However, we've got a bit of a road to continue to travel, where most of us will not be vaccinated. And we have to maintain that vigilance and patience. Unfortunately, this has been a long haul for all of us, and I know it's been extremely hard, and I'm thankful for those who have maintained the public health recommendations. But we're getting closer to being able to have that vaccine available for all, but it will still be a bit of a path before we're there. So that's my comments and statements, and just thank everyone and wish everyone a good first couple of days of the new year.
Thank you. So a few more questions. What is being done to protect Black and Latino communities in Berkeley? Sadly, just like throughout the United States, African Americans and the Latinx population have been disproportionately have contracted COVID-19. I think it's an example of broader health inequities and systemic racism. In the city of Berkeley, our Latinx population is particularly highly vulnerable to contracting COVID-19. And so we've done a lot, and we're going to continue to focus on outreaching to and doing specific testing and support of those particular communities. But we've worked with organizations that work with our Latinx population, with faith leaders, nonprofits, to coordinate testing and education, to focus on specific outreach to particularly bilingual populations as well. So this is a focus, and I think it's something that we're all committed to, is really having, delivering these services from an equity lens, because we know that the people that are most disproportionately impacted are people of color by this virus, and it's even happening here in the city of Berkeley, and it's unacceptable. So there are things that we've been doing, and we're certainly committed to continuing, whether it's in the vaccine rollout or whether it's in how we do testing or some of our other public health response, to be focused on doing it with an equity lens. And I know that's a focus of the state government as well. There's a question around salons. Is there any funding going to the beauty sector? Restaurants are getting funding. Mr. White, I know that we recently provided matching funds to Alameda County, and there's about $400,000 that was available for local businesses to receive grants. I think of up to, was it $2,500 per business? And I think personal care services or beauty salons or barbers were eligible to apply, I think, for some of those funds as well, if I'm not mistaken.
That's correct. So the council did allocate resources to the Alameda County CARES program. And so I know I'm waiting for the final list of number of businesses did receive support through that channel. What I did also want to share, use that as an opening, is to make sure that everyone is aware of our Office of Economic Development newsletter, which anyone can sign up for. And I share that because we are using that as a platform to provide regular and timely information on resources available to the business community. There is one available right now through the state. The state has opened up a grant program. The applications opened on December 30th, and they actually just extended the deadline to January 13th because of the technical issues that they've been having. So I do really want to encourage folks to be looking to our resources. We have a lot of connections and links to state resources that are now available, both grants and loans. We are right now in the process of evaluating. We opened up a special loan program around COVID-19. The first round of applications has closed, so we're evaluating those at the moment. And if additional resources are available after that evaluation, we'll make that broad announcement to the community. So I just want to make sure that everyone is aware of the resources that are currently in process to really help and assist our struggling merchant community.
As Mr. White noted, if you are a local business and you are looking for additional economic assistance, go to CAReliefgrant, all one word, .com, and you can apply until January 13th for the California Small Business COVID-19 Relief Grant Program. We are also continuing to raise money in the Berkeley community for the Berkeley Relief Fund, and whatever resources are available, the city will consider providing additional grants to small businesses as well. There were a couple of questions around school reopening, which I think we addressed previously. And just noting that the decision around reopening schools is a decision of the Berkeley Unified School District Board of Education, but we are committed to working with the school district and supporting their efforts to reopen as quickly as possible. And it's certainly my top priority that we are prioritizing when we are allowed to reopen schools first, and doing what we can to support the district in their efforts to reopen. And I do, there was a question around disparities and how kids of color and low-income kids have been most disproportionately impacted by this pandemic. And there's no question that, just like with the health disparities and people of color getting COVID-19 at greater rates, this pandemic has really shown, I think, some of the serious structural problems in our country around race and around economic inequality that we know have existed for many, many years. And sadly, those divisions have increased as a result of economic impacts and public health impacts. And it's going to be some time for us to really rebuild after we get through this. But I think for that very reason, to make sure that the learning loss is not so significant and kids are able to get the support that they need, that's why it's important that we reopen the schools as quickly as possible. I already talked about the new state funding, the $2 billion that's available. And we do not have a timeline yet about when BUC will reopen. Part of that's contingent on when the state will allow it. And also part of it is contingent on their plan for reopening. But certainly we support their efforts to reopen and we'll be doing everything we can to help assist them in that process. And then there was a question around rent increases. This resident received a rent increase this year. And under Berkeley law, if you live in a rent-controlled apartment, your rent can be increased to the annual general adjustment, but can't be increased beyond that. And so for 2021, that equals a 1% increase in your rent level. Last year, the state of California approved Assembly Bill 1482, capping rent increases in most new construction to 5% plus CPI. And so we encourage residents to go to the City of Berkeley Rent Board's website, cityofberkeley.info/rent, for information about local and state rental laws. Some rent increases are allowed, but evictions are prohibited. We want to be clear about that. Evictions, in pretty much nearly all cases in Berkeley, are prohibited in the City of Berkeley. And we actually recently strengthened our eviction moratorium just this last month in anticipation of new state legislation. So we want to let everyone know that evictions are prohibited, and there are local and state laws around rent increases. So I think that covers pretty much all of our questions. So I just want to take this opportunity to thank our panel, our esteemed city leaders who are working so hard to help get us through this crisis. And once again, just reiterate what I think many of us have said, which is that while there may be while there's a vaccine that is being rolled out, albeit not as swiftly as some people may like, dependent on the availability of the vaccine. And we hope that a new Biden administration really making the rollout of vaccine a priority. I think President-elect Biden has announced that he wants to have 100 million people vaccinated in his first 100 days in office. That real serious, concentrated, coordinated effort on the part of the federal government and really bring resources to bear to really expand the availability and the distribution of vaccines, and really coordinating with states will help us expedite the process to the extent that we can and get more people vaccinated. But as we are seeing this surge, and we don't know yet the effect of the New Year's surge. So that's why it's so important. This week is really important. We don't know the effect of the New Year's surge, that we really follow very strenuously and seriously the stay-at-home order and practice the public health precautions and requirements that we put in place to help minimize your exposure and the exposure of our community to COVID-19. So let's get through this next few weeks and know that there's light at the end of the tunnel. So with that, I want to turn the floor over to our esteemed panel and see if they have any additional comments before we close. Dr. Hernandez, anything else you'd like to add to the Berkeley community tonight?
No, I have nothing else to add. As I mentioned earlier, I wanted to wish everyone a happy new year. This year is of hope, though we have to get through these next few months where I worry that we're going to see additional cases and additional deaths here in the city. So I do want to wish everyone a happy new year and ask people to continue to adhere to the public health guidelines. And I'll turn it back to you, Mr. Mayor.
Thank you. Dr. Vargas, anything you'd like to share with the Berkeley community before we close?
Just to say, I've lived in and around this community for most of my life. We're strong. We'll get through this. We'll have some great stories, hopefully endure some losses, unfortunately, but I believe in Berkeley. I know we will get through this and just stay together.
Thank you. And Mr. Acting City Manager, anything you'd like to add before we close?
I think it's all been very well said by everyone on this town hall, and I just really want to appreciate really Mayor and the council for your tremendous leadership getting us through what was a very difficult year. I know that folks are tired. I know that folks want to move on, but as Dr. Varhuswal said, we are strong together and we're going to get through this. So thank you very much.
I think, as evidenced by the many questions we got about the vaccine, I think people are really ready to move on. And we all are. This has been such a difficult year. And for those that have lost family members or who have contracted COVID and who are still with us, we know that it's had a tremendous impact. And it's impacted people's economic health, mental health, but we're almost out of it. And so our focus is, how do we get through these next few days and weeks, knowing that we need to combat this surge? And then how do we reopen with the focus on equity and really on our kids and on our businesses? So please know that this is our highest priority. And I just want to thank the team here who have done such an amazing job and who have really put their heart and soul on the line and who have really been committed to helping protect and get our community through this. So with that, I want to thank the Berkeley community for joining us today, for your questions. Please stay tuned about our next town hall. Please be safe. Please stay at home. Please remember to wear a mask if you do have to leave the house. Please practice physical distancing, and remember to wash your hands, and please stay safe. Have a good evening.